Dear friends, welcome to YouTube channel and our DRVET Dr. Vet channel. In this presentation, we will talk about Downer cow syndrome. In short, it is called as DCS. The word downer means the animal unable to get up, remain long time down. That means remain in sitting position for a long time. Here there are group of syndrome. So diagnosis is easy, but etiological diagnosis is very difficult. Name is Downer cow syndrome. It is not that it occur only in cow. It occur in buffalo also and other animal also. Since the video is very much important and very long, I have divided this video in two parts, part 1 and part 2. Here we will discuss part 1. In that we will discuss definition, etiology, epidemiology and clinical pathology. Here we will see the definition of Downer cow syndrome. The word Downer means animal is unable to rise, unable to get up. Animal sits constantly for 24 hours and unable to rise and unable to rise even after two consecutive calcium treatment. And if the animal is unable to rise, it is graded as downer. The most common etiology of downer is a complication following hypocalcemic parturient very common etiology. Most of the cases occur after parturition and as a sequelae of milk fever cases. Here we will see the etiology of DCS. There are many etiologies. Complication of hypocalcemic parturient or milk fever is one of the important etiology. If there is prolonged recumbency because of over long delay for more than 4 hours in the treatment of milk fever, it results in ischemic muscle necrosis. If there is prolonged recumbency, there is pressure on muscle, so there is pressure on arteries and veins of the muscle. So the muscle will not get proper nutrition and oxygen. There is ischemia in muscle, and finally there is degeneration and necrosis of the muscle. If this ischemic muscle necrosis develop, the chances of recovery is less. Sometime during treatment, if there is insufficient amount of calcium given as a treatment for milk fever, because of this insufficient amount of calcium, animal will not able to get up. There is poor response. Again, the same phenomenon, ischemic muscle necrosis, poor response. We know that the phosphate is useful for energy, for muscle. If there is hypophosphatemia for a very long time, persistent, there is lack of energy to the muscle, and so also animal is unable to get up, resulting into DCS. We have seen about the complication of milk fever, over delay treatment, insufficient treatment also lead to this DCS. Over and above this, traumatic injuries of hind limb muscles, especially due to dystocia, that leads to DCS. The involved muscle may be medial thigh muscle, rupture of gastrocnemius muscle, injury to hip joint muscles, and obturator muscles. If there is injury to the muscle, then lack of energy to muscle, animal is unable to get up. If there is injury or inflammation to the muscle, there is pain in the hind limb, and due to the pain also, animal don't like to get up, and there is DCS. Similarly, traumatic injuries to the nerves of hind limbs. The nerves are sciatic, obturator nerve, radial, and peroneus nerves. This nerve may get traumatic injury, may be due to dystocia, and due to this, there may be paralysis or paralysis of the hind limb, animal unable to get up, and results DCS. For muscle energy, for the health of the muscle, many electrolytes are required. For contractile power of the muscle, many electrolytes are required. If there is electrolyte imbalance or deficiency in serum, the muscle loses its contractile power, results into DCS. If there is hypokalemia with hypophosphatemia, the animal is unable to get up, and it manifests as a creeper cow. The cow is alert, the cow is bright, but the animal is unable to get up and crawl about here and there, but couldn't rise. If there is toxemia due to some serious infectious disease, there is toxin in blood, it causes depression of the central nervous system and toxemia to the muscle also. The several diseases which are very toxemic for acute or acute mastitis, acute diffuse peritonitis, aspiration pneumonia, traumatic reticulitis, traumatic pericarditis. In this, animal is unable to get up. One reason is toxemia. The other reason is these diseases causes pain in the body, and due to pain, animal will not get up. There are several managemental causes: malnutrition, slippery floors, epidural anesthesia also causes DCS. Here we will see epidemiological factors of the DCS. We have already seen that most common etiology is sequelae of milk fever. Milk fever generally occur 2 or 3 days after calving, especially in heavy milk producers. Heavy milk producers produce more milk, more colostrum. Milk contain plenty of calcium, rich in calcium. So along with milk, there is draining of calcium from the body. The result is hypocalcemia. That is the important etiology for milk fever and its sequelae DCS. Along with milk fever, there are many other diseases also occur that also act as a predisposing factors or helping factors for DCS. We know that DCS, DCS is common during peak lactation years of high producers. We already know milk is rich in calcium, more milk, more drainage of calcium from the body, hypocalcemia, and DCS. Already we have seen it is a complication arise due to delay or incomplete treatment of various diseases after parturition, especially milk fever cases. So to avoid DCS, earlier the treatment of milk fever, better is the response. There should not be any delay. Plus, there must be a complete appropriate treatment. So chances of response are more and chances of DCS decreases. Various conditions, poor housing conditions, excess fatty animal, many septic disease conditions, and malnutrition may act as a predisposing factor for DCS. Here we will see clinicopathological changes. Serum calcium, phosphorus, magnesium, and glucose level is normal. Hematology normal in recently caved, but later on there is neutropenia with left shift. Serum creatinine phosphokinase enzyme increased. This suggests muscle damage. Increased SGOT also suggests muscle damage. Sometimes there is moderate ketonuria. This may be due to decrease in food intake, decrease in energy intake. So there is development of mild ketosis. There is proteinuria and brown colored turbid urine in severe cases due to myoglobinuria. There is muscle damage, muscle degeneration, muscle necrosis. So this muscle protein will appear in urine. Myoglobin separated from muscle goes to blood and appear in urine. Sometimes there is abnormal ECG finding. Thank you very much for observing the Dr. Ved channel. Requested to subscribe this channel and requested to forward or share this channel to our veterinarians and those who want to get this knowledge. Once again, thank you very much for observing this video.